featuring Aftan Jameson. So we're really excited to have her here. Aftan has a rich history working with KU and out in the Lawrence Douglas community, and her position has evolved. So we're really excited for her to kind of give some behind the curtains insight of what her work has been, and maybe some advice for future. I see a nice chunk of community health students, some PE plus health students are in here too, and I know there's a couple of sprinkle of other majors along the way too. So we're really excited for her to give some insight, and we appreciate her time this evening, and I appreciate you all coming. So with that, I'm going to hand it over.
Of course. Thank you. Can you hear me? Good. Okay, my name's Aftan Jameson. Like she said, I am a KU alumni. My undergrad, my alma mater is the University of Kansas, so I'm really happy to be back. I'm going to be walking around because I'm going to tab over on my slides a little bit as I talk. My current position is with the American Academy of Family Physicians. So I will go over my history in public health, and I've had like a unique opportunity to work on a local level, a little on a state, and now I'm on a national level. So the AAFP is, you know, a large medical organization similar to the American Academy of Pediatrics. They would oversee pediatricians. We focus on primary care, that specialty. And so the headquarters are in Kansas City. It is my first time working in public health on a national level. When I first started, it was a little intimidating, but now I don't know if I'll ever go back. I love it a lot. So my junior year, I think it was, at KU, I had no idea what I wanted to do. For those of you that are undecided, I totally get you. I don't remember exactly where I landed in the community health field as to why, but applied behavioral science ended up being my major that I majored in. I did the community health route in the ABS department, and it was really good for me. So with that major, you have to do a practicum. Most have to do that. And so my practicums, because I did the community health path of it, I remember interning at the health department, which is now called Lawrence Douglas County Public Health, and then also at Watkins at the Health Education Resource Office. And so I got a good variety of different opportunities of what it's like to be a little bit more hands-on, which is the entire point for an internship or a practicum. I realized that, you know, I think I stumbled in the right path and went from there. One of my first jobs was at the Metabolic Research Center. Has anybody, you guys, ever heard of that? It's a national organization. It's a weight loss clinic. And I was in my 20s. It was one of my first jobs, like I said. It is where I grew my love for nutrition. I made lifestyle changes that I still have today. I learned a lot about myself. It was a really rewarding job, a daily rewarding job where you are doing nutrition counseling one-on-one in a private setting for people that are coming to you asking for help for sometimes the first time in their entire lives. And it's different because it was a non-clinical setting. You know, they often will go to their doctors and they would maybe get help or not get help. It just depends on the situation. But for them to, you know, come to you, ask for help, pour themselves into you. We would ask for them to come in pretty regularly. It was for the accountability piece. It was part of the program. It actually made them more successful. And so they would weigh in front of a stranger. It's a lot. So I like people. I'm a people person. My goal at the time, I found that if I was able to build rapport with somebody, to go above and beyond, to try to connect with them, they would bring their walls down. And once they dropped that wall, they're like, oh. And they're not afraid anymore, and they trust you, and then they're willing to work with you moving forward. So I loved that job. Like I said, that is where I first grew my love for nutrition. After that, I wanted to go get my master's. So I left metabolic. I was there for almost 4 years, but I got my master's at Baker. And it was a Master's of Liberal Arts. And have you guys ever heard of Baker University? It's really close by. Yeah, really good school. Different than KU, private institution. The one take in hindsight that I would say about my graduate experience is, for those of you that are interested in doing a graduate school, is I didn't know it at the time, but I absolutely use it now, is strengthening my writing skills. And at the time, I was a little resentful about it. It's like, oh my God, this is really hard. It's just different than bachelor's degree, right? So graduate school will ask so much more of you. And so now I'm doing a lot of writing in my current job. And I don't know if I would have had those competency skills if I had not gotten my master's. So absolutely no regrets. But, and then lastly, this was actually while I was at KU, working at KU, which I'll get to in a second, but I did the new certification program in nutrition. It's through KU Edwards campus. And so that was when I was over. After my master's, I started working for Hero at KU, which I think you guys heard me say I interned at my senior year of college. So I was really excited to get this job. Again, I went back to nutrition counseling. So that's what led me back to KU was my experience with nutrition. I had, private one-on-one weigh-ins, but now with students for a program for weight management, lifestyle modifications, and, the rapport building and goal setting is what I would essentially do for students. There were some students that have never had to think about what food they put in their mouth their entire lives. Especially, I will say most of the people that came to me when I was at KU were probably international students. I would gather they never, in whatever country they were from, never had to worry about it. They come to the United States and all of a sudden they don't have a grasp on it. And so there was a lot of education. It's the health education office, right? So there was a lot of education that went there, a lot of getting people, up on their feet with the competency skills to move forward in life at a young age for sometimes the first times in their life. And so they will have that skill set forever. And so they were really appreciative. I really liked that job, and what I liked most about it is you didn't have to talk about money. So at Metabolic, obviously that program was not free. And so that was the biggest hindrance in my job, I remember, is you have to talk about money. They have to pay for it. They are investing in their health. It comes at a cost, right? And so once you bring up a dollar amount, you feel like it was like a sales pitch. It just kind of ruined all of the work that you had tried to make with those clients. But at KU, with your guys' tuition, you have student health fees that you pay. They're required. And so of those student health fees, one of them goes to Hero to pay for us to be able to offer these programs to you. Another one, it goes to the health center in general. So like when you go see a doctor, you don't have a copay to see that doctor. It should be free. It comes from your student health fees. So that's how Hero is there for you. That is the investment that the university took to hire people to work with students to make them healthier as they are here on campus. And so whether it's 4 years or longer, investing in your health while you're here, you're more likely to be successful in your career at KU if you're healthier and learn those healthier traits. So yeah, it was a really great job. I didn't want to leave it. I've been at my current job for 3.5 years almost. I didn't want to leave it, but I had an opportunity that kind of fell in my lap that I couldn't resist, and that is at the American Academy of Family Physicians. So before I get to that, I will talk a little bit more about my coalition work. So while I was at KU, along with the nutrition piece, they had tobacco program that needed to be handled as well. And I had a little bit of experience with that, but just with my practicum. Like I helped plan the Great American Smokeout when I interned at Hero. And so I took it on, and at the time I was a little resistant, but now I'm so thankful. So that opened up a completely new world for me. So I wasn't siloed with just nutrition expertise, where I was able to take on tobacco. And so it was before COVID. And so me offering a tobacco cessation program, which they still offer today, and I say tobacco, but that includes nicotine as well, because vapes are considered a tobacco product. But at the time, offering a one-on-one cessation program for students, obviously it was much like the nutrition program, it was voluntary. And it just was at a time where not a lot of students took me up on that. I think that vapes were new enough and so many years into it where people didn't realize yet that they were harmful. We didn't have a lot of research showing us that. People weren't exhibiting side effects from their use. And so at the time, who wants to quit if they don't realize that it's bad for them? And so I was like in my office thinking, how can I help if people aren't coming to me? And so I joined a coalition, Livewell Douglas County. Has anybody heard of Livewell? Yeah, so it used to be Livewell Lawrence. I think Livewell's been around for about 13, 14 years. It's now Douglas County. So we are not just doing work for the impact of City of Lawrence. It's going to be all of the county. So we have Lecompton, Eudora, and Baldwin, which are often forgotten about, but very important. They have completely different communities. They're oftentimes dependent on the City of Lawrence as we pave the way with certain things and with our policies. So with Livewell, we did tobacco regulation and tobacco control for Douglas County, and I'm still involved with Livewell today. But I took on their tobacco committee. I've chaired it a couple times. I've even chaired the coalition itself. It was a real good leadership opportunity for me. and to be able to see what's a nonprofit world doing out there with essentially a bunch of volunteers. I mean, most of the people that represent LiveWell, they are there because they represented like DECA or the health department or LMH. I was representing campus at the time. And so I think I was one of the first people on campus to ever, be involved that much in that coalition. And so there is often, a divide, I don't know if you've noticed this, between campus and Lawrence. Have you noticed that? It's kind of, campus can be their own little world, and then Lawrence can go and make decisions without any consideration whatsoever of the students on campus. And so I don't believe in that. So I was the voice for KU. I helped with tobacco regulation for the city and some policies, which I'll get to. But it's like a town and gown thing that Jenny McKee, for those who know Jenny, she has been talking about this for years, how the importance of integrating both campus and the city. And what we did is, if anybody in this room is ever interested in health policy work, which I'll talk about more, it's fun, it's hard. You have to have patience. It is a marathon, not a sprint, which means it takes a long time to introduce health policy, and there's a lot of factors. So for LiveWell, we worked really closely with Lawrence Douglas County Public Health as they spearheaded it mostly, and the city commissioners of Lawrence. And so we needed some more regulation in town. And so I think it was the end of the year of 2022. So it took about 4 years of us working on this one policy called Tobacco 21. Do you guys know what that is? It's now passed on a federal level, but it's essentially raising the age to purchase tobacco products from 18 to 21. And it's, it passed on a federal level while so many municipalities were working on it, and it kind of took us by surprise because we didn't realize that the current administration at the time was going to pass that. But that just kind of geared everything up. And once you have it on a federal level, you got to think about other types of governance. You have state levels, and then you have, city. So we were able to convince City Commission to pass Tobacco 21. Also with that policy, which was really important, we passed a tobacco retailer licensing program. It was rather new at the time. I want to say we were second in the state to pass something like it. And it's just a regulatory program for tobacco retailers. It is just the opportunity to have some regulation. And so there's about 80-something retailers, I believe, in the city of Lawrence that sell a tobacco product. And if you had no regulatory program, how would you know that? So you have to have data, you have to have some regulation. And then we wanted at the time to have some more regulation, but if anybody ever gets into health policy, passing bills, passing policies, they're always imperfect. You always have to compromise. You have somebody opposing this part and somebody agreeing with this part. And what is the most important is what is most beneficial is if you pass something rather than nothing. So we had to basically pass a policy that was modified but imperfect with the intent of, we're going to be back in a couple years because we're not going to forget about the rest of the policy that we felt as public health professionals should be in there. And so what that was, which we're currently working on, is density and proximity locations for the tobacco retailers. And so, it allowed the health department to oversee the program, which was important, and that was also unique because usually law enforcement oversees a program, but City of Lawrence proposed that we would like for that not to be the case. That usually unintentionally targets vulnerable populations for health equity purposes. We wanted the health department to oversee it, and it's going really well. So they now have all this data with all of these people that sell vape shops. They now have the data that shows where they are. And if anybody's done any research about big tobacco, so the people that own Altria and Marlboro, that owns most of the vape products, are the people that owned the cigarettes decades ago, that targeted, like, let's say your grandparents, that targeted certain populations, youth, etc. They're just using those practices again with vapes and doing it all over again. And so we know that because we've already been through that. But we know that they target certain populations, but now we have data to show Lawrence City Commission that, look, there is a vape shop that just opened that shares a fence with Schwegler Elementary. We don't think that that's healthy. We don't think that that's right. An elementary school. And if you go around Free State High School and look at a map, they're just saturated. If you go on the east side of Lawrence, saturated. Around campus, saturated. So that's just showing that it's predatory, it's strategic, and it's on purpose. And there's really nothing we can do with that right now. And City Commission, you know, they have so many things to work on. Public health is not on their forefront all of the time. So we have to educate them to let them know, just to keep it into consideration, so you can grandfather the existing ones in. But moving forward, maybe if we have 13 over here and a new business comes in and fills out an application to open a vape shop, sorry, we're full over here. These are too close to that church, too close to that babysitter, that daycare. Maybe check out the west side. Maybe check out something, the south side. And so we have that proximity. We have all that density maps that we can show them. And then once you put a visual in front of their face, though it's obvious to somebody that doesn't know anything about public health, then they can amend that policy and they can make recommendations moving forward for further regulation, just to, you know, have a healthier public. Does anybody have any questions so far about health policy before I move on? Because I nerd out, I could talk forever. It's fun, okay. Oh, sorry, go ahead.
I'd be curious,
Yeah.
just as a business owner,
Yes.
how do you get a business owner to buy into a policy of such that
Yeah.
says, well, these are predatory practices that you put in the business directly next to, elementary school or something to that effect?
Like approaching the business itself that's maybe behaving that way? Yeah. So really, it would be less so on the retailer and maybe more hands on the policy holders that actually rubber stamp and approve the businesses that come in. If they have that knowledge, and because if you have the conversation with the retailer privately, I don't know if that would go so well, because they likely know what they're doing, maybe they don't, maybe it's unintentional, but once you explain to them, City of Lawrence may be new to you for a business, but this is what the data that we have. We would recommend you moving on this side of town, and if they can't afford that rent, or if they don't want to go there, then it's maybe not meant to be. But that's a great question. That one's hard. But that would be the health department that would essentially do that.
I think I like the data, showing the data.
Yeah. Yeah. So I'm really excited about that amendment of that policy. The third part of the 2022 policy that we passed, which most people don't know about, it's just something we did under the radar, was called Clean Indoor Air Act. Have you guys heard of that? That's an existing policy from 2004 for the City of Lawrence, where you could no longer smoke a cigarette inside any public place. And so that only, at the time, we sold cigarettes, right? We did not have vapes. They were not developed yet. So we amended that existing policy while we were doing it all of regulation. We had the opportunity, and now you cannot vape inside legally. And so my statewide impact I'll touch on a little bit is while I was at KU, and of course while I was still working with LiveWell, the state of Kansas, this was right before COVID, I want to say it was 2019, as Governor Kelly kind of employed the Kansas State Department of Education and KDHE to work together to have a statewide vaping task force, and I was asked to be on it, again, to represent KU. And so it was a really cool opportunity where you have people from all over the state. So I'm lucky we just would drive, I mean, this was before COVID, so we didn't do virtual meetings, we did in person. We would drive to Topeka, and so I had a 30-minute drive, but I had people from western Kansas drive up for it. I had superintendents from small 2A public school, rural areas come, because they needed to have a voice in the room. If we were going to make guidelines for the entire state to issue out for all public schools of what to do when students vape, you have to consider all the differences of all the populations of the state. And so that was really cool. Obviously, an urban area like Douglas County and Johnson County, completely different than something that you would get in far western county. And so we issued out those guidelines. So they were guidelines, they were not requirements. The schools could take them, they could modify them to make them work best for their community and for their district, or they could not use them at all. But essentially what was happening wasn't working. And so what was happening is you have all these officials in education and in high schools, and they have this rush of vapes that are all of a sudden popular overnight, and they don't know what to do with them. So they were confiscating them, and they were punishing the children. And so anybody in public health or behavior change just in general, when you want to see behavior change, usually punishment is not your first go-to, which is why a public health professional wouldn't recommend that. There are education and there are other things that you can do before you do the punishment. And so I don't know if that took off. I haven't been on the committee since then, or see if they've collected data to see if there's been improvements, but it was a start. And then COVID hit, so we stopped meeting and, you know, the whole world shut down. But it was a cool experience. So at AAFP, so like I said, our headquarters are in Kansas City. I started out as like a program, I'm in the Health of the Public and Science Division, which is like a fancy word for public health. And so it's really cool. It was my first opportunity to work on a national level, but also my first opportunity to integrate public health professionals into healthcare. And so I feel like those are often siloed. And so it's like prevention and then like reactive healthcare is kind of how I look at it. But now we're working together, and that's only best for, you know, to improve patient outcomes. So I've done quite a bit when I started with them, a lot more clinical than what I was used to and not in my background. But you learn as you go, and I embrace all the opportunity because it only helps me gain, you know, expertise. So I've done a lot of vaccine work. I started in 2022, so COVID was still being worked on quite a bit. Respiratory viruses, obesity. I have kept with tobacco work for them. We have a small division in Washington, D.C., where they actually lobby and they do all policy work. And they go to the Hill and they meet with Congress, and they are basically the voice for family physicians. What is going to help primary care? What bill can I put my eyes on before it's passed to make sure that it's going to help primary care, because that specialty is really our focus. And they are lobbyists, but public health isn't really their background. And so they will lean on some of us in my division in Kansas City if we have more expertise, if we could have our eyes on a bill, if we could weigh in on whether not that we rubber stamp or endorse, but would we approve of a bill moving forward, right? Is that going to be best for doctors, which in turn will be best for patients? Is that going to you know, work with our strategic alignment of what we're focusing on as an academy? There's a lot of eyes. But it's been really cool for me to do a little bit of policy work on a national level, and for the first time. And then, oh gosh, almost 2 years ago, I changed scope again, and now I'm at the Center for Women's Health at the AAFP. And at first, again, you get all these opportunities and you're kind of nervous, but then you start to embrace it. You're like, wow, again, you get the opportunity I like to learn, I guess, not everybody does, but I like to learn. And I have a great passion for women's health, and wow, what a climate we're in right now where women's health is important. So I feel like it's good that I'm there, doing a lot of work, like I said, on a national level. For some people that don't realize, family care doctors, they can do all types of care. They refer a lot, if you need a specialist, obviously, like for your heart, they're going to be a little bit more trained, but they can deliver. They're one of the few specialties that deliver babies, and people forget about that. They're also unique where they could have a baby that they delivered, and then they do the 6-week postpartum checkup with the mom, and they can treat the mom and the baby at the same time because they're trained. So it's literally womb to tomb that they can treat. It's very comprehensive, and so there's a lot of things that go into that. And not that I'm biased, I feel like they're like the most important specialty out there. And most people think when I have a doctor, when I grew up with my doctor, they're thinking of a primary care doctor, but they don't realize that, all the different specialties and how healthcare works. But it's been pretty fun. So I was going to talk next about some core public health competencies of what to keep in mind for those of you that are trying to get into public health. And so understanding the interaction of policy, which I've talked about, community, the healthcare system, and how they all work together. So like a systems thinker is something that I would recommend, systems thinking as you move into the field. It's just the most effective way to make public health outcomes be the best. You have cross-sector collaboration, so you're gonna talk with policymakers sometimes, you're gonna work with nonprofits. Most public health is dependent on money, so you're gonna get nonprofits or not-for-profit is most common what you see. We don't have money, and we need money to work, right? So grant funding and finding funds are also going to be a part of your job. But it's critical for comprehensive public health efforts. A commitment to equity. I am a big, strong component of this. Like being aware of social determinants of health, systems that are out there that actually cause disparities of public health outcomes. I feel like as an individual basis, you have to always be thinking about it. You have to always integrate it into your work, and you have to always fight to get it into your work. If health equity wasn't worked on like that in such a, not an aggressive way, but like being a little bit progressive about it, then I feel like it wouldn't be good. Like it would just inevitably go back to where you'll have like a dominant population that would benefit over the other populations. And so that one's a big part of the work if you're getting into public health as a professional. And then lastly, communication and adaptability. So kind of like with policies, how I mentioned that first local policy I worked on, I think it was 3 years before it got passed, and it wasn't easy. There are a lot of hands in the bucket. There are a lot of things in your way, and there are a lot of barriers. And so being adaptive is something that you would absolutely, a trait that I would recommend picking up if you haven't already. But it's complex, you have to navigate through it, and public health is constantly evolving. So you have to, if you don't know, if there's something that has popped up, I don't know, a pandemic in 2020, a worldwide pandemic, and that is the first time you've ever heard about it in your lifetime, and you're a new young professional in the field, research it, hands-on, learn as you go. So always have that thirst for knowledge of teaching yourself, because nobody's gonna teach you. So researching it yourself would be my best advice for that. So a little bit about your early career, what to expect, and then I have my take on what a senior leadership in the career what they focus on, so we can kind of compare the two. What do we hire for, but don't write down? So essentially soft skills. Let's see. You're gonna have a lot of listening, a lot of learning, I said, a lot of patience. It's not that people don't want to hear from you and your background and your expertise, but you don't have the expertise that maybe a senior leadership would. So just be okay with being, sitting in the back seat. You could possibly make recommendations, but that's about it. So there's just going to be a lot of that. And as you learn as you go, and it's just literally, that's how it is. You just dive in and you learn as you go, and everything is different. An effective collaborator as a team member, I feel like it's a team sport. You will rarely see this field siloed. You just don't. There's all hands on deck, cross-sector collaboration, like I said. So you're working with people outside of your organization, but even inside. You're going to be a team, and you got to work together. And so for the people that stand out are the people that, in my opinion, can't work in a team setting. They stand out, and not in a good way. Like they make it really clear. Like I have somebody at my work right now. She's been there for 27 years, and she is considered a vaccine expert. So she is hard to replace, but she is sure along the way learned that team efforts and collaboration was not what made her get as far as she has, and she stands out. And so she's having kind of a tough road. So going in with that mindset, knowing that that's the case, if you're team oriented, you'll be totally fine. Collaboration and trust. Hiring managers value individuals who build trust, communicate, and then collaborate, like I said, across diverse teams. Internships and volunteer roles help. That's your hands-on experience. That's your best bet. They carry more weight, I think, than GPA often, so reflecting applied competence. And then emotional intelligence, so humility and situational awareness contribute to long-term success as well. Being aware of the climate around you, what's going on, and always be willing to help. But if you do have a strength coming in, like if you have a background and you're in this team and you've learned enough about your team and you find that there is a gap in your team, like a content gap, and you're like, wow, like this is not only my passions but my background. Let them know that, because they're willing to fill the gap. That's what you're constantly doing, is finding gaps and then filling it in and working on that, because there's just so many thousands of ways you could go about to do this work. But moving forward in a strategic way is best. But definitely let them know that you have that competency and you don't see it in the group setting, and that you're willing to step up in that capacity. And I think that will go over really well. I'm talking about collaboration a lot. Any questions so far before I get to senior leadership? Oh. having a growth mindset, leverage individual strengths, like I said, and building credibility early. So career progression and leadership. So senior leadership expectations. When you're young and let's say you're senior leadership, so you're gonna get your executives, you're gonna get your directors, your senior strategists, your managers, people that actually manage people will likely be up here. And they've also been in the field for a long time. So, you know, they should be up there, right? They are focusing on different things. You're more hands-on in the work, task-oriented, being what's being asked of you. But they're looking at system-wide stewardship. So they're looking at it as a whole system. They are overseeing entire systems rather than individual projects. They have to ensure alignment in population needs and resources. Funding is also going to be a lot on their mind of constantly trying to find funding or write grants to solidify the funding. But strategic alignment is integrated from evidence on their end. So they integrate evidence into strategic actions to guide policy and program development effectively. Collaboration and partnership. So you have an effective leadership that requires coordinating across agencies and managing partnerships to avoid siloed approaches. And then, like I said, they're going to probably mentor staff, they're gonna manage outcomes, and they're gonna uphold accountability for sustainable mission-aligned initiatives. So one example that I can think of is I have a current grant with the CDC. It's on fetal alcohol spectrum disorder, and it's a 4-year grant. And so a lot has happened in 4 years with our funder, right? And so I have a national partnership with, you know, really similar orgs like ACOG, which is the American College of Obstetrics and Gynecologists, so they oversee OBGYNs. And then we have American Academy of Pediatrics and all these nationwide orgs that absolutely should have a seat at the table when it comes to this work on a national level. But with somebody that is going to be more systems thinking is going to, like I said, going to think about that continued relationship with your funder, whether to move forward. Does the work align with your strategic plan? Moving forward with that project, with that grant money, there's just a lot that goes on there. And so we've actually had some organizations pull out completely because they don't want to work with that funder anymore. We have some that were denied funding one day, and then they took them to court, and then they restored their funding, I think, within a couple days. It's just been tumultuous. So that senior leadership is gonna make that executive decision, right, to move forward. Maybe we're gonna move forward, it's best for and ultimately what's best for us is what if that work is going to help our doctors provide that care, screen for patients who may exhibit behaviors of fetal alcohol spectrum disorder, and then improve patient outcomes. But moving forward with like the next phase, which we would have, you know, applied to continue this grant, maybe they would make that decision whether we would move forward. So there's just a lot to consider, and that wouldn't, you know, as an entry-level person in public health, that wouldn't ultimately fall in your lap. But there are people that are thinking of that. It's complicated. It's not always easy, and I don't know what the right answer is. But there is something that is always getting in your way of just people that work in this field just want to do good. They just want to reduce harm. They want people to be healthier. They're usually passion project people, and they want, you know, it's similar to healthcare. I just want to help people, right? But it's not that simple all of the time. Okay, so kind of, I'm going to end with a comparison of what we're working on and like how it would look from the lens of an early career person versus a senior leadership. So the scope of influence, so what you choose to work on, the scope would be task and project level. You guys are going to be likely somebody else is going to decide the scope. And they're going to tell you how to integrate it, and you're going to actually implement it. You're going to be the implementers. And then the senior leadership would consider system and population level of how that work that is being done would help the population that we're trying to serve. The decision-making, similar. You have a guided, evidence-informed, and they're going to be more strategic policy shaping and further down the road stuff. Collaboration on both team members would be, you're the contributing team member, and they're the convener and alliance builder. The accountability piece would be you delivering the assigned work, I already said, and they would focus on outcomes, sustainability, and trust. And then lastly, the time frame would be short to mid-term for you. That would be your project load. And then for them, it would be long-term system changes. So five years down the road is not uncommon for a senior leadership person to be thinking about. So it's kind of cool when you have people working on different things, it just meshes, it just works. But it's not always said out loud what senior leadership is working on, and so it's not always apparent. So that's why I wanted to dive in the difference. But that's really all I have for you today. I was just going to take questions at the end since I talked at you for a long time. Any questions?
I know you really briefly talked about like mentorship, but what did that kind of look like for you? Because like I definitely see like the importance of like having, I feel like every area of life has this, but like there are like people who are really in the field and then people who are getting into it. So how did you
like boots on the ground? Yeah.
Like in school or in grad school.
Sure.
Like, what did that look like?
And so you're asking like a mentor for me, like what my experience was?
Yeah, if that was something that you pursue or what advice you have on that.
As finding a mentor, is that what you're asking? Or mentoring somebody?
Both.
Okay.
I feel like it's kind of like you find one and then you become one because now you're like kind of cycling.
Sure. I mean, I guess I didn't realize it at the time, but you do find them as you go. Like I said, you have very passionate people in this field, and so they're always willing to help. And so if you have anybody in the field that has been in it longer than you, they'll likely take you under their wing. I would say for me, Jenny McKee is one of those people. I adore her. I still talk to her, even though I haven't worked with her for years. But it's just kind of an unassigned mentorship that you just find somebody that you have something in common with, or maybe similar passions, similar interests, and then you work together as you go. For me, mentoring people, I don't know, my coalition work with LiveWell, I feel like that would be the case for me. I did not join LiveWell thinking that I would still be in it 7 years later. And it also, still to this day, it no longer even ties into the current work that I'm doing, but I just can't leave because I love it so much. And I love the city of Lawrence. But when you have volunteers in a nonprofit coalition, you're going to have a revolving door, right? You're going to have people that are always coming in, and some people that are taking on maybe some opportunities or being asked to chair a certain work group. And I've had experience with that, so I had a phone call yesterday with somebody that was being asked to take on the chair of our new tobacco-free living work group. So it's just one of those natural things that happen. It's usually not a problem finding. Does that answer your question? Yeah. Okay, good, thanks. Anybody else? You want her?
You go first.
Yeah.
Students go first.
Of course, yes.
Okay, so with your experience in health policy and women's health,
Yeah.
what were your thoughts on the overturn of Roe v. Wade? How have you given the resources to women that aren't interested in following through with their pregnancies?
Okay. So Roe v. Wade happened June of 2022, I believe. And I didn't start at the AAFP until fall of 22. So not only was I not at that organization, I wasn't even doing women's health. I have some personal opinions about it as a woman, but I wasn't in the situation I am now, where I now understand the integration of public health and healthcare and the impact on a national level. So that one's hard. If I was in my current role at the time, I'm sure that would have affected my work greatly. We still have things happening that aren't quite as large as the overturning of Roe v. Wade, of Dobbs, that happen to us all the time, that we have to pivot and we have to think about what is going on. It's hard to put yourself in their shoes, but what's going on in the patient room? What's going on in the doctor's offices? What is it like for women? Because like when you work for a national organization, you get kind of stuck up on the national level. It is so hard to realize down below, boots on the ground, like what's going on. We do have chapter organization, AAFP has chapters in every single state. And so that state chapter would likely do a little bit more work on that, since every state is different in that regard, right? And it hasn't happened on a federal level, you know? But yeah, that one's hard.
Thank you.
You're welcome. Yeah.
You talked about doing some vaccine work.
Yeah.
What is your take on this sort of, since the COVID-19 vaccine came out, what is
Yeah.
your take on this sort of movement to anti-vaccination?
So I did dabble in a little vaccine work. I don't currently do it, but it is very much in my division, so I get updates on it. So we have ramped up vaccine work greatly. So what's happening in the healthcare setting is you're having, on an individual basis, more and more patients that are coming in being like, no, I don't want to get this vaccine, or they I've even heard some horror stories of having their, their child, having a rare disease and they're unvaccinated and they still don't understand that the preventive part of the vaccine. So what we've done as an organization, I can speak to, especially since the ACIP committee, which is under HHS, and it's the Advisory Committee for Vaccines, which we've always been a part of. They have, I don't know, you guys may have heard this, but they have turned over their complete panel of committee members and took on some different stances that what most medical organizations and most doctors agree with. And so we are in an unprecedented time that we have to move forward and we have to think. It is not required for doctors to follow CDC guidance, it's just guidance. It has just historically always been what's happened. And so us, AAFP and AAP, pediatricians, have both moved forward with our own vaccine guidance. We have published it ourselves. We're even in the process of forming our own committee, similar to what the ACIP committee historically was, of our doctors, of our experts from across the nation, so that patients and parents and people can have a trusted source because people are confused. People don't know what to do. They're getting conflicting information all over the place. And you would say that, like, the person, if they're confused, just go to your doctor. Not everybody has that access to a doctor. Maybe they don't have transportation to get them to a primary care doctor, or they don't have internet to use telehealth. Not everybody has the same, walks of life in order to have equitable access to healthcare. And so us as an organization, we took it on and it was a leap. And we are just starting. I feel like we're full force. It is being widely receptive. People are receptive to it. It's been positive. And so we're going to move forward. I think we're the only two that have moved forward. It makes sense for primary care and then kids, pediatrics, to move forward with our own vaccine guidance. And we're going to publish it. We're going to go from there until hopefully we can maybe restore our institutions with the federal government to enact that again as a whole nation, because that's ideal. It's less confusing, but it's always constant work. It's going to be work. I don't think it's going away. I think it's going to be work, hard work, for the rest of my lifetime. We're going to have to work on this. We're going to have to be proactive, and we're going to have to restore some of the damage that has been done. Mm-hmm. Anybody else? Yeah, go ahead.
What would your advice be on how you translate health data to policymakers, especially when their thinking is a lot different than what health professions would be?
Yes.
And how do you go about creating compromises where it's not just what everyone just to get something passed versus something that will actually be effective?
Yeah. So if you have data, if you have current data that is showing that your recommendation should be the way that you recommend, always consider that policymakers, and I always do, they have so much on their plate. Like, they're not just thinking about public health, they're thinking, so the tobacco retailer licensing, they're thinking of the retailers, they're thinking of the businesses that are coming in. We're not going to stop businesses, that will hurt our economy, right? There's a lot to factor in there. So you just have to become the expert, and you have to just educate. We've had a lot of conversations because there's a fine line of whether you can say, I want you to vote yes for this. I can as a person, as a member of the community, but if I did it on behalf of my nonprofit coalition, that would be considered lobbying, so that is not okay. So we've had a lot of conversations, but you'd be surprised how receptive they are to people. They actually lean on experts in the community or nationwide, wherever you're doing this, to educate them. They inform them, and they make the informed decision. It works pretty well. It may not happen as quickly as we'd like. It may not happen as perfect as we like, but that is how it works. Like I said, I don't remember when I told you the imperfect policy that happened in 2022 that I was involved in. I don't remember exactly the conversation when they pulled the amendment to it that had the proximity and density locations that we really wanted. I remember being a part, it was a Zoom, so I had just done a presentation for Lawrence City Commission, and then my part stops. And this was really frustrating because then they start talking, and then they, in their mind, maybe they misinterpreted what I said. And so in their mind, they're thinking, no, this is bad. This is bad. I'm like, wow, we were not clear. But I couldn't say, I had to sit there in silence the rest of the night and just let it tank and let it happen for them to ultimately end the decision, in the meeting with the decision to remove it. And we're like, oh God, because you can't, it's hard. Now, I could have followed up, I guess, as a community member the following day and said, like, this is what we were trying to get, just to educate them a little bit more. But sometimes you just have to leave it because, like I said, I have a focus and I'm a little biased and I'm always thinking about public health. They're not. So that's okay. And it's not the end of the world because you can come back and you can regulate it some more. You can have a new policy or you can amend it, and it will be fine. And with tobacco work, for example, it's constantly evolving. Like, big tobacco is 10 steps ahead of you at all times. And so talk about pivoting. If you want to do tobacco work, you're going to be like blindsided by what big tobacco pulls. So you're constantly pivoting anyway. So maybe it's sometimes okay to resurface the conversation even years down the road, because maybe it's applying it there is more important at the time based on the current events with tobacco, who knows, than previously. It all works out. It's fine. It is ultimately beneficial for the community. It's just, I'm sure if you talk to like a legislator in DC, they'll say the same thing. I could never have that job, you know, because they just fight, and then they can compromise too, of course. But not everybody's not happy all the time. There's always somebody that has to take the back and be like, okay, you know. But I guess that's good for collaborative work. Maybe it's good. Did you have a question? Yeah.
So you have shared that you've had a lot of new opportunities that kind of organically came
Yes.
out, but that you had some initial nervousness
Yes.
about them. And so I find that nervousness or anxiety is a huge impediment for students who are trying new things. So what are some steps that you took to combat or overcome that angst and grow your confidence?
Oh, so like I said, I like to learn. And the more I teach myself and the more I research and the more competency I grow, the more confident I become, and that's what worked for me. Even though I had some hesitancy when tobacco got thrown at me when I was first at KU, like I said, I have a learning curve here. And as long as you make that clear, they know that. You're gonna learn as you go. And similar to me right now with women's health, I work with people that's all they've ever done. And I'm now writing the grants for them. And I have to act like I know it. So I like to do back shelf, like, researching so that I can have a seat at the table and act like I know what I'm talking about. I'm going to teach myself because, guys, the education's out there. There's research out there. There's studies out there. You just got to maybe do a little bit more research. And then for me, like I said, that competence that I would derive myself would grow my confidence, and it worked. Yeah. But it happens a lot. But now I look back, like I said, and I'm so thankful for it. Like, I'm so much better at my job. I understand the whole sector of public health now rather than if I had just siloed in nutrition and actually gone the registered dietitian route, which I really considered. I would have been limited in what I could do with that. And I don't know if that would have filled my cup as much. So I'm happy how it turned out. Anybody else? Yeah.
So why the liberal arts master's as opposed to an MPH?
Ooh, good question. So honestly, I had an opportunity for a free master's, and I took it. And Baker is a really good school, and it's a private institution, really good curriculum, but they're limited on their programs. It's not like KU, it's just different. And so at the time, I was like, oh, okay. They had Masters of Organizational Leadership, which I almost did as well, but that, again, would have siloed me moving forward as a leader. What if I don't want to be a leader? What if I just want to grow competencies in all the things? And so that's why I chose the MLA. But I uniquely had an opportunity for a free master's, and I know that's not the normal route. So if you ever get free school, free education, guys, take it. My cert that I did through KU, the nutrition one, because I had worked at KU at the time and I was doing nutrition counseling anyway, that was free. And so 2 out of my 3 degrees basically were free, and so take it. But great question. I still think about getting an MPH, I do. And KU, through their their Edwards campus, like I said, with my cert for nutrition. I think they have an MPH one. They're kind of expanding that a little bit more, and certs are more widely recognized sometimes if you couple them with degrees. Yeah?
You kind of mentioned having to educate yourself, but what do you feel like your scope of practice is being between public health and healthcare? And like, what's the most clinical you ever taught?
Ooh. There's some projects that come my way that are so clinical I do not understand. I'm not a doctor, I'm not a clinician, I don't treat patients, right? And so, but what we do is we lean on doctors, we work with doctors. So I will use grant money and I will pay stipends to a doctor, and they are our leading expert, and how it should be. When you're a membership organization and you're, making continuing medical education or any type of education or a publication for doctors, they don't want me to write it. There's a lot that goes into that, but they want a leading expert in that. So I work really closely with doctors. I have found it to be a good experience. I'm sure it's not great for everybody, but they've been really, really great to work with. You'll find some doctors, I'm just constantly fascinated by their work. Again, with family doctors that do a lot. So right now, you'll have family doctors that will have certain specialties, or they will be board certified in something like down the road. They'll realize I'm family practice, but I want to be board certified in obesity. And so they'll do that route, and they will only do obesity treatment, which is really cool, because that's them growing their expertise and honing in on like a core competency under primary care. So they have that opportunity. But did you ask me what my practice was in between public health and healthcare?
Like what you feel like your scope is?
My scope of practice. That's a great question. I see the benefit, I really do, of integrating the two. I have worked opposite of doctors and I've worked with doctors, so I've done both. And it is better to work with doctors. There are things that doctors have limited training on, that they will admit that, and they will refer out, whether it's a dietitian or for my tobacco cessation with my tobacco treatment specialist cert that I did. It's very intense training, and I can provide cessation. I'm maybe even more qualified than a doctor, which is fine because doctors have, 7 minutes with each patient? They can't do everything. They can't solve the world's problems. So they can't do it all. So leaning on some other people that work in public health that understands the systems and the funding and all the things that work into health education is good when you work together. Thanks. Thank you, guys.